We're here today with Dr. Melissa Dunlap at Aspire Health Clinic, where they do chiropractic, massage, and nutritional health care. Thanks, Dr. Dunlap, for taking time to talk to us today.
Thank you so much for being here. Looking forward to it.
At My Breast Choice, we always try to help women get through their journey easier. I think chiropractic care would be really important both before and after surgeries. What do you recommend to women who know that they're going to have breast cancer surgery?
That is a great question. So in our office, we do more of what's called corrective care, meaning you're going to come in, we will evaluate you. A lot of times we will do x-rays. If you have some imaging already, it's a great idea to bring it in so that I have an idea of what's going on. So think about the spine being the control center for the whole body. So most of the upper back is going to be what controls the heart, lung, and chest area. So if you have some misalignment there, then you could have some further issues. So before surgery, let's check that out before you're gonna go be operated on. And then after surgery, let's work on that. Because think about you laying in the same position for maybe 2-3+ hours, maybe an arm out to the side. So what's that gonna do to your body? It will tighten it up and maybe make other things out of alignment. So let's check it out. Come on in.
I know that after my surgeries, sometimes the part of me that hurt the worst was my back and spasms, I think, that I was having. What kind of treatment do you recommend for that?
Okay, so for kind of more muscle specific, we do have massage therapists in our office. They are excellent. They're very, very good at identifying where the problem may be and then working on that specifically. So chiropractic and massage are really going hand in hand. We're working on bone, muscle, nerve, all at the same time. So I'm working more on the adjustment, which does affect muscle and nerve. They're working more on just the muscle specifically. So I'm going to do a scan through the body and see where some of those issues may be, and then let them know more specifically what we're working on. So obviously you have the calming effects, but then you will also have greater blood flow, and you will release some of those constricted areas, make you feel relaxed, calm, and able to easier get back to your regular activities.
I understand there's other ways besides just a chiropractic and spinal evaluation that you can evaluate a woman's health. There's so many things going on with surgery, chemotherapy, and the things that we go through. What else do you recommend for women?
So correct. So we are looking from a more holistic standpoint. So we do hair analysis, meaning we are going to lift up some of the back part of the hair, take directly from the scalp. It's not as scary as it sounds. We just take a little bit. We can send it off to have it analyzed to see where you may have some loss of minerals, where you may have some heavy metal toxicity, and then what we can do to detox and cleanse your body of that. So think about the treatments that you're going through, and it's going to kill some certain cells. Now we want to build back up. So the hair analysis is very, very specific in letting us know where we may need to go next. The other thing we can do is muscle testing, which I can do in the office. So muscle testing meaning where are some areas in your body not functioning properly, and then how can we treat that? We can treat it with an adjustment like we already talked about with massage, and also with some nutritional supplements just to give your body the extra support it needs.
And one thing that I noticed while I was going through my journey is that a lot of the doctors that we're working with, the surgeons, the oncologists, they don't necessarily pay attention to our minerals and our vitamins in our body.
Right.
So that's where you provide complementary care, I would say.
Correct. Yeah, just kind of that extra step. So they had training in one specific area. I've had training in one specific area. So they really go hand in hand. Check with your doctor on all of the things that you've already done, and let's kind of see the next step for after surgery and beyond.
Now we're going to talk a little bit about essential oils. I have used these in my daily life, and I truly, truly love them. Could you please tell our patients what you might recommend for women as they go through their breast cancer journey, what type of essential oils they might consider and how they would use them?
Right. Okay. So like Diane said, I also use them in daily life. If you're not a fan of them, I hope you will consider that because they are excellent. Let's talk about 3 today. So the first one I would mention is Thieves. This is Young Living Thieves. So this one is great for immune support. So this is not used to treat anything or diagnose anything. This is just used for immune support. What you can do is actually put a drop into your hand, rub those together. Take a really deep breath in, get it through your nose and your mouth. That's great immune support. Another way to use it would be just to put a drop on the bottom of your feet. Again, helping with the immune support. Let's put this back. And other one I would mention is lavender. So this one is a great, most people have heard of this one. This is a really, really pure form of lavender. You can use it the similar way that you use the Thieves. You could also put this into a diffuser. So it'll just be water and the oil so that you can smell it all day long. It's really great to get into your olfactory system. That will affect your whole body, have that nice calming effect. Especially like you said, sometimes patients will have trouble sleeping at night. This is a great alternative to just medication after medication. So check with your doctor on that one. The other one I would recommend is Stress Away. So this one is kind of self-explanatory, like the name says, Stress Away. It has more of a sweet smell. This one is nice to use either a drop behind the ears or on the neck so that you're kind of smelling it all day long, so that it helps you with some of those emotions and stressful situation that you're going through. So this is a really great way to support your system during the stressful time.
Thank you so much for your time today. I appreciate you helping us educate women and patients out there going through their breast cancer journey.
No problem. I'm so glad you guys came out. Thank you for tuning in. I hope you learned something on some other ways, some alternative ways to support your system through this journey.